Come back. I said today's conversation was going to concern everybody. We are talking about blood sugar. I'm laughing because I can't remember the last time I checked my blood sugar level. I can't remember, and I would say I have good reasons for it, but sometimes, when you talk about blood sugar, my dear, let's not leave the conversation anyway. So we have our medical doctor, someone who is a friend to the family, a friend to us, even though he ran away. I've not seen him. He didn't even give me my birthday gift. Let me be reporting him now. You know who I'm talking about? If I'm attacking somebody like this, you all know it's Dr. Isibo. Good morning to you. Good morning.
Good
You see,
morning.
as I called you.
You have exposed me now to the
Yes, so
world.
I've exposed you that you did not even.
We would have discussed this in
I
private.
refuse to discuss.
You
in
didn't have to
private.
go that far.
I refuse to. I refuse to. Let me bring it to the open so that before you leave, you will definitely do the needful. Now we are talking about blood sugar. Before we start, what is blood sugar all about? Is there a specific definition to blood sugar?
Well, as it sounds, blood sugar is just the amount of sugar in your blood.
Okay.
There's no big deal about it. But we tend to take note of blood sugar when we talk about DM, diabetes mellitus, where a situation where the amount of blood sugar in the amount of sugar in the blood is more than what is expected for an individual. So at that point, it becomes very significant. But if not, at every point in time, there's always sugar in the blood because that is the fuel we use to carry out our daily activities and every actions that we carry about.
What's the difference between high sugar and low sugar? And what's the danger in between these two? When they say your sugar is low and your sugar is high, what is the difference? And how dangerous is it for you to have high sugar level and low sugar level?
When we talk about low sugar level or high sugar level, most of the time we focus about high sugar level, but we don't talk so much about low sugar level. Now, the difference is when you have low sugar level, you are just talking about minutes before the person is gone.
Whoa!
But somebody can have high sugar level for weeks, months, years, even if nothing is done. There's always a grace period to correct it. Now, for low sugar level, it's not so frequent. Maybe the person used a particular drug, the person has insulinoma, the person is fasting, and things like that. Most of the causes of low sugar level can easily be corrected. So because most of it can easily be corrected, we are not worried about it. It is not a recurring thing. Nobody wants to be labeled with a disease tag. Unlike diabetes, which is the high sugar level, we don't really cure it, we manage it. We can manage it significantly that the person will be able to live a normal life and all of that. But the danger is that if one has low sugar level and nothing is done within minutes, that is the end of life. But for high sugar level, there's a grace period to address it, weeks, months, and even years. And something can actually be done to reverse it. But the downside is that, okay, once you have it, you are diabetic. Most usually you are diabetic for life, and they just have to manage them kind of till the end of life. So, but they tend to come with that stigma, you are diabetic. And if one is diabetic, even the children, grandchildren, they have to watch out for it.
Okay. So this morning, I really want us to be very clinical and practical because this thing affects everybody, even children. Now, I'll read something to you and then I'll ask you how, if this case was presented to you, what you got. But he said, now the kids are on holiday, and I know when they resume, there are tendencies like this to always happen. Kids will always, and most teachers don't really know what is the cause because they are coming from home now. During a morning assembly in a primary school, took longer than usual, and they had a debate that morning at about 10 a.m. A child was noticed to be complaining of drowsiness and sweating. And which sometimes you feel like is a normal thing, when a child says, that's why I don't even joke. Once my child, my head is aching, I'm feeling drowsy, I say, sit down first. Let me understand, do you want milk and that? Now, a child was complaining to the drowsiness and sweating shortly after she fainted. Now, just after her classes was about to be disciplined for making noise, what is the possible cause of such an incident? Now we have drowsiness, we have sweatiness. Somebody will say it's tension just because they were about being punished for noise making. So it could be as a result of the fear of, I don't want to be punished. And maybe they'll say, this child is faking that the child fainted, he did faint. But what could be the possible cause of that child fainting at that point, or the drowsiness?
Now, when you look at the scenario at hand, the first thing there is said the assembly took longer than normal. And this happened at around 10 a.m.
in the morning, which the child is expected to be very active that morning.
Yes. Now, if you look at it, there's a reason why the first food you eat for the day, we call it breakfast. That is when you are breaking your fast for the night. Okay. Now, we don't know what happened the previous night, if that child ate or not. It's possible that morning, because the mother was rushing to work or something, she couldn't prepare something. And the mother said, oh, please, there's no time so that you will not be late. Your school bus is around. Just take your food, put it in your bag. When you get to school, eat. The child got to school late and did not eat. The child was hoping, okay, immediately we finish assembly, I will quickly eat something. But this time, instead of assembly to finish, maybe between 7:30, 7:45 to 8 o'clock, or even 8:15 latest, the assembly took longer than normal. The child did not eat last night. This morning, the child has not eaten. And it could just be, maybe by accident that it was the time they wanted to discipline a class for making noise that the child fainted. But more importantly, the vignette also said something that the child was sweating, was drowsy. For some, they have tremors. Some will tell you it's as if the heart is beating fast. If you see any child that faints in the morning or whatever, assume that child has not eaten until proven otherwise. The first thing you want to do for that child, you give Coke to that child. Yes. We'll call it the triad of hypoglycemia.
So you just administer carbonated drink to that child?
Not necessarily carbonated drink. You want to give anything that contains sugar. So either you give Coke or you prepare tea, put sugar and all of that. Don't go and do green tea and give to that child. Because now it is assumed that we are thinking this child has hypoglycemia. So there are three things you look at for. Hypoglycemia means low sugar level. Okay. So the three things you look at is that if you do the test at that point, the sugar level will be low. 1. 2, the child is showing the symptoms of low sugar level, the drowsiness and the sweating. Then maybe if it were to be an adult, the person will tell you, I can feel my heart beating, as if my heart is beating fast, palpitation. When you're about to pass to the other side of life, your body will be giving you sign. Kelvin, I go at the go. So
they go anywhere.
Your body will give you signs. So you have to pay attention to your body. But let us assume this is maybe a 12-year-old child, 10-year-old child. The person does not really know what palpitation is.
Yes.
But you could see that the person is sweating. And the person can tell you, I'm feeling drowsy. It's as if everywhere is blurry. The person is sweating. Those are signs of low sugar level. The first thing you want to do, give the person any drink that contains sugar. If it is to be hypoglycemia, immediately the person feels better and, you can carry on from there. Something like this happened some time ago, many years ago. I think I just finished school then. I said, okay, I'm done with school. Before I start my housemanship and everything, let me quickly I've done my foundation class in church. Let me quickly do my membership class. Because I know during school, the time was not there. Once I start my house job, you cannot even predict when you will work and when you will be off. You are off the day they say you are off. And you work the day they say you work, you don't have, you are not in charge of your life anymore. So I say, okay, within that window period, let me quickly do the program. So I did it and everything, you know. But part of the criteria is that they will take you to pass through the different aspect, evangelism, prophetic, whatever you must go through. So they took us to another branch of the church, and they were doing VG there that night. And it was during 70 days prayer and fasting period and all of that. So when we got there, it was after, you know, you break your fast in the evening, then go for the VG and all of that. So I noticed while we were praying and everything, I know you saw this aggressive prayer and all of that. We were praying, and you know, when you go for a deliverance program like that, you will pray, they will say, when you are praying, you open your eyes so that somebody does not start manifesting and the person will bite you or something. You know, so I was praying along the line, I was walking about, I opened my eyes, then I noticed that, some of the coordinators were rushing to the back, you know. So when I saw they were rushing to the back, the prayers were still going on. Many of us that came for the program were not aware. So when I saw they were going to the back, I'm like, what's happening? Maybe there's an emergency. Let me go back and check.
As a medical doctor.
You know, so as I was going, they said, no, leave, go back to your seat, go back, you know. I said, okay. I was going back to him. I said, one woman, I said, hold on. Are you a doctor? He said, are you a medical person? I said, yes, I'm a medical doctor. Say, please come on. You know, and I went there. I saw that it was one of the coordinator. You know, he was on the ground, very weak, breathing fast, and, you know, he was sweating all over his body. They say, what are we going to do? What could be the cause? I saw that the man is sweating. I said, this can be hypoglycemia. But mind you, this was around 2-3 a.m. I said, we need to give him any soft drink that contains sugar. But, you know, we didn't come with food. So we're looking for sugar. While we're looking for sugar, you know, the man that was down, that we are trying to rescue, now said that there's a bottle of Coke in his bag, you know. You know, so we quickly got the Coke and everything, and we gave him the Coke. And afterwards, it got better. And I said, how did you know you needed Coke? I said, he was sweating, he was shaking, and all of that. So these are signs of low sugar level and everything. Yeah. And, you know, when it was better a bit, they asked him, what happened? He said, that outside the fasting we were doing, he was doing maybe 2 or 3 days dry fasting. It was time for him to break the fast, but he missed the time he was supposed to break the fast because he got back from work late. And he just started coming from the program that he will take it to the 4th day and that happened. Okay. So
all right, let's hold you on there. Let's go on a commercial break. We'll be right back. This morning we are still discussing blood sugar on our Healthy Thursday, and we still have our handsome Dr. Isidro right here. This morning we are really dealing with clinical cases, like practical cases. That's what we want to discuss. It's not a time for question and answer, because he's the medical doctor and he needs to really tell us so that when we see these things happening on the road, we will know what to do. It's not when you now start saying pour water, the devil has come again. Sometimes when in church, you're saying it, you're praying too much. Calm down. Take a chill pill. Relax. If your eyes are turning, you're not the devil. You're not the demon that time. Sit down. Reach out for something soft with sugar and drink to save your life. One story that touches the heart. Okay, so we have another scenario here. It says, a 55-year-old male was seen by a doctor after contemplating suicide. Wow. But after a brief discussion, it was noticed that his wife just recently left him. He said they were cordial. The only little problem they had was just erectile dysfunction. Okay, erectile dysfunction. That's not a little problem. He is a known diabetic patient, but he said that does not affect him in any way. Really? He provides and makes her happy aside the other side, aside the other room. He feels betrayed. What advice would you have for him? Now, when the person sent this and said it's just it's not small, erectile dysfunction is not small, and he's diabetic. Now the wife has left. Now he is saying, but I provide money, food, and those things. as a doctor, what advice do you have for such a man? You're already laughing.
Well, coming from a woman, she's telling you erectile dysfunction is not a small problem. When we talk about sugar, I said the two problems of sugar could be that the sugar is too high, the sugar is too low. So one of the problems when you have elevated blood sugar level for a prolonged period of time, we have two types of complications for elevated blood sugar. We have the microvascular complication, we have the macrovascular, meaning those ones that affect small vessels. So the ones that affect small vessels could be that, the person is having wrist drop, neurological. The person is having wrist drop, the leg is dropping, things like erectile dysfunction, gastroparesis. Person telling me it's like I find it difficult to digest my food and all of that. I'm having just discomfort around my abdomen, and erectile dysfunction is also another part of it. Now, he is seeing it as a small problem. He does not think it's significant. Now, because diabetes most of the time does not even come with pain, patients don't take it serious. They ignore it. They take their drugs when they want to, occasionally. And in this part of the world, we like to rebook things in the name of Jesus.
Yes,
and we don't want to do the due diligence, follow the medical. They say if you will not take the advice of a doctor, you will learn from the complications of diseases. And that is what is happening now. Erectile dysfunction is something that is very important to women. If he takes his drug appropriately and all of that, this can be reversed. Depending how long has he had this problem, that is another thing. But this can be reversed. Then from what I can see, he also needs to see a psychiatrist to talk to him because he's already contemplating suicide. Especially when it's coming from the aspect of a man. They say about 80% of suicide cases, 80% will be from men. When you talk about reported suicide ideation, and men don't usually report suicide with ease. If they want to do it, they just do it. But now you have an idea that he's thinking about it. So allow him to see a psychiatrist, let them talk to him. Then he needs to see an endocrinologist. They control the sugar properly and then everything can be restored. The wife, do I want to judge the wife? Men, we judge women all the time. So maybe this is just one of the cases where the wife is judging the man. Irrespective of what the situation is, women are judged for infertility. Oh, she cannot give birth. I've waited 2 to 3 years. I cannot continue. She's barren. The man will move on. And sometimes we think it's normal. Now you cannot perform in the other room and she wants to move on. You want to judge her. So it is either we judge each other or we decide not to judge each other and we decide to work things.
Like this now, how long will it take for him to have return back to normality? If he takes his drugs as a medical doctor, if they came to you and said, okay, let's assume now the wife decide that let's find solution and they meet you, are you going to give her a timeline that between so and so time they should be, or that keep taking your drugs? And
now, when it comes to erectile dysfunction, there are multiple factors. The age of this man you mentioned, you said 55 thereabout. When men get to 55, 60 thereabout, the libido will drop on its own because of age. You cannot compare the libido of a younger person compared to an older person. It will drop. But it's a multidisciplinary approach in the sense that this kind of patients, you need to control the sugar and all of that. If after controlling the sugar, you don't get the desired results that you want, you also need to see a urologist. They are the ones that manage erectile dysfunction. It can be given other drugs, other things can be done to improve the erectile dysfunction, but most likely we'll get a definite result. Something can always be done for him.
Okay, so we have another case here. It says, a patient came to the clinic to report that his previous diabetic medication, which is also one of the big problems you're having, was working well until recently he bought from a different pharmacy. And while still taking the right dose, his sugar is still elevated. he thinks NAFDAC should arrest the pharmacy. Do you think that way? Now, I have someone very close to me who her sugar level keeps rising. Her sugar level and her BP keeps rising. And one day she brought some drugs. She said the ones the pharmacist gave her, she's an elderly woman, she's going to her 60s. The ones the pharmacist gave her, when she took it, it was working normal. And then when she sends her nurse, the nurse will say, oh, we don't have this one, but they recommended this one. And then when she takes the recommended one, her sugar level starts going up. Now, this is a similar case to what this person sends now. In this case, should this pharmacist be arrested? Is it that the person sold fake drugs, or I don't understand, coming from a medical doctor?
There's a lot of things in play. From my own experience, we don't have NAFDAC have done a lot of work in recent times. We just don't give them the due credits that they deserve. Sure. It is very easy to cast aspersions. You talk to people in derogatory manner. It is very easy to see the faults of people. But we don't really give people the credit that they deserve. We don't have so much of fake drug, I must say, right now. Yeah. That does not mean we cannot do more. There are different reasons why a previously diabetic patient the regular dose you are using is no longer working. Because one, if I had seen this person, there are some questions I want to ask. If I meet a diabetic patient, the person is diabetic normally and all of that, and the person is now sick, maybe the person has sepsis, the person has infection and all of that, the person is having fever. Now, when you are going through stress, because your body is trying to acclimatize to that stress, response to stress, your body starts producing some hormones, some things that we call cortisol, and cortisol will release more sugar. Now, when you have an infection, your body sees the infection as stress. Your body does not know when you have not slept for how many days and you are going through stress. It will release cortisol. Your boss is stressing you in the office every now and then. The moment you see your boss, you start having palpitation, you are afraid your heart is beating fast, your body releases cortisol. Cortisol produces more sugar. You have an infection, your body sees it as stress. The infection is giving you fever, things like that. Your body releases cortisol. Now, because this is what your normal sugar is without stress, and we take the drug, we reduce it to the normal level. But now, instead of having it at this level, in addition to the infection you have, the stress you are going through in recent time, this is now what the sugar is. And you are now using the same drug, expecting it to get to that level. That is why when we see people that have infection and all of that, a previously known diabetic patient, and you come to just see your sugar is very high, we'll say, oh, what is the precipitating factor? Something is pushing it. Is it that the person has infection? We check the chest, we check the urine and all of that. We want to know what's going on. We will increase the amount of the dosage of the drug we are giving you previously while treating the infection. As the infection is resolving, we keep monitoring your sugar level. With time, we'll notice, oh, your sugar is dropping. Even with the increased dose we are giving you, we'll start reducing your dose again. Start reducing your dose till we get to a certain level. That is one scenario. That is one. Two, when we talk about diabetes, there are two major types. We have type 1 diabetes, we have type 2 diabetes. Type 1, the part of the pancreas that produces insulin. Insulin is a hormone that drives sugar into tissues or different cells in the body. You can have diabetes, I describe it as suffering in a land of milk and honey. You have plenty, but you are suffering. So that is why people that are diabetic, despite the fact that they have plenty sugar, they are still weak and all of that. Because the sugar is in the blood, but the sugar is not entering the cells. You need it to enter your brain so you will think well. You need it to enter your muscles so you will function well and everything. But you see some of them, they are skinny and all of that. Now, because they lack insulin, insulin cannot drive the sugar into the cells that need those sugars. Now, for type 1, the pancreas is what produces insulin, the beta cells of the pancreas. We say there's destruction of the beta cells. So the cells that are even supposed to produce insulin, they are destroyed already. Now, because these cells are destroyed, maybe they've had an infection, and due to that infection, there's an autoimmune disorder along the line that attacks the beta cells, destroys it. These people are not producing insulin. For this type of people, you don't give them oral medication, you just give them insulin directly. It is not very common, and we see it in younger people. If I see a 5-year-old diabetic, a 3-year-old diabetic, that is type 1. You know, if the person is less than 40, some people are now say, okay, we are using less than 30 now, type 1. We also have the other type, which is type 2. You are producing the normal insulin, but your body is not just responding to it very well.
Doctor, let me, I have something, somebody said, so so that you add all together now. A 60-year-old man noticed as if he is wearing socks, even though he's not wearing any. He is not a known diabetic patient, very healthy, and brags not have any reason to visit hospital for the past 10 years. But his father and mother died of diabetes. What could be the cause? Now, this is, please, as many as you said, this is what we can take for now. Just so that you round it up with what you're saying. What could actually be the cause of this now?
Now, for the previous one, if the person is not responding to drug, it could be that, the person has a type 2. Type 2, you are producing insulin. Your body is not responding well to the insulin. Now, because the person is producing insulin, the person is not, if care is not taken and you don't manage your sugar very well, over time, type 2 diabetes can progress to type 1. Meaning the person is producing insulin, the body is not just responding to it as well as it should. Over time, it can be that more beta cells are destroyed, and the amount of insulin the person is producing naturally is reducing. So at that stage, we have to be increasing the dosage of the medication. So that could be the case. So one, if the drug is not responding well, don't rush to go and arrest the pharmacist. That might not be the case. Let your doctor find out, is it that you have an infection or something that makes the dose that you require at that point to be higher? Or is it that you have moved from type 2 to type 1, or more of your beta cells are destroyed? For the person with socks sensation and all of that, well, we also call that diabetic neuropathy, where they have, and we have something we call peripheral vascular disease, where the vessels around the leg and all of that, they are clogged, kind of. Okay. So blood is not flowing well to that part of the leg. So there is reduced sensation, and some, they have abnormal sensation, tingling sensation. We usually see it in people that are not taking their medication very well. They have long-standing history of diabetes. You know, they are not using the right drug, or maybe they are using other means, herbal or whatever. So that is usually the right. And now, if you notice, they said this person is not a known diabetic patient. However, father and mother died of diabetes. That is a strong family history of diabetes. Now, remember I said we have type 1 and type 2 diabetes. Type 1 diabetes, if I will pick anything, this person is 60-year-old.
Yes.
So most likely the person is diabetic, unknown to the person, and it's a type 2 diabetes. Now, type 1 diabetes, we say you see it in the younger person. Because the person is not producing any insulin at all, the symptoms comes very fast. So that is why you see it in younger people. Type 2, you are producing, but you are not responding to it. And type 1, usually the family history is not so strong. You can see it in the father, the children don't have it. Remember we said maybe they have one infection or something, and along the line, the immune system destroys the white blood cell. But when you look at type 2, the family history is very strong, and you see it later on. There's something in that vignette. They said the man has not gone to hospital, is it for 10 or 15 years, and is bragging with it. There's no award for not going to hospital for 10, 15 years. There's always a reason to go to the hospital for checkup. You know, I don't believe in all those prayers to say, doctors will not eat my money. Please, we have to feed too. But you can go for checkup, yes, not necessarily. But I'm sure if he was going and all of that, they would have picked it. that is diabetic, but there could be other reason that maybe he has lumbar spondylosis and all of that, why he's having tingling sensation, but that sucks sensation, is usually we see it in diabetic patients.
Now, as we round up, what is the average sugar level for every human being? Like if I go and check my sugar level, what should I look at? Okay, it's normal and this is high.
Now, when you check your sugar level, it depends on the time you are checking your sugar. Okay. We say usually, most of the time, we want people to check their sugar when they are fasting. So if somebody comes to me and all of that, you want to check it when you are fasting. Now, it should be either equal to or less than 126 milligram per DL. You can convert it to millimole per liter if you divide that by 18. But 126 milligram per DL, less than or equal to. Now, if you have between, let's say, greater than 126, but less than or equal to 140, we say that is impaired fasting sugar. Okay, it's not so high, but it is impaired. If you get anything greater than 140, the person is diabetic. Because now you have not eaten for at least 12 hours, but not more than 14 hours. That's why I say when you come to do the test, take your last meal 8 p.m. and you come in the morning around 8, you do the test. Not that if you come around 9, we will still do it for you. That's 13 hours. But not that you come to us that you want to do the test and you are coming around 12. If you come around 12, that value we get, we cannot administer it anywhere. We cannot use it. Why? Because your body has sensed it that, it's as if Joy Abu is fasting, and if we don't do anything, she will join our ancestors. Please let us help her. Your liver will start producing glucose on its own and release it into your system. So if we check it at that point and we are seeing 156, I will not classify you as being diabetic. Your body has responded to the fasting that you have done. So we want you to do the test after fasting between 12 to 14 hours, not more than that. Anything more than that, we will not do the test for you.
All right, thank you so much. Thank you for the fact that today we took it from the clinical aspect, and for everyone who sent in experiences, thank you. I hope Doctor has done justice, which I know now you have learned how to check your sugar level. I'll go and check mine. Tomorrow I'll bring the results. All right, tomorrow is Friday and we will be discussing how do you know you're doing well? What are the signs you're doing well? That will be our conversation tomorrow. Have a wonderful Thursday and stay safe out there. I am Princess Joy Ayo Abu. Bye for now.